What are the effects of fibroid on pregnancy and effects of pregnancy on fibroid? First, coming to effects of fibroid on pregnancy. Now, very easy. If you actually don't mug up, you just imagine there is a big tumor inside the uterus. First of all, it was not letting the patient to get pregnant. She got pregnant. Now, what can happen? First of all, it can abort, right? She can abort. So, abortion. If not abortion, then what else can happen? It can be a preterm labor. So, it did not let the pregnancy to go up to 9 months. So, either it aborted in the first 24 weeks, that is the definition of abortion, or it led to preterm labor. What else can it do? Because it is not giving enough nidation, enough nutrition, it can lead to IUGR. Okay? The growth of the baby might be hampered. What can it do else? What else can it do? It can lead to malpresentations. It's very, very obvious why malpresentations can happen, because the uterus is not giving enough space. The head may not come down. It might get impinged because of the fibroid. So the baby might turn oblique or transverse. It can take any shape. Okay, any presentation. What else can happen? There may be a lot of respiratory embarrassment. Now we know that already the patient is suffering from respiratory embarrassment because of pregnancy, but because the fibroid is also growing, it already has made the uterus very big, so that can lead to excessive respiratory embarrassment. Now, what else can happen? It can lead to urinary retention during pregnancy. Already urinary retention is quite common in pregnancy, especially in the retroverted uterus, which has a pregnancy growing, and if it doesn't straighten up, then it might impinge on the bladder angle, and then it can lead to retention. Similarly, with the fibroid, it can lead to retention. Now, after delivery or during delivery, what can happen? It can obstruct the labor. I told you in the central cervical fibroid, obstruction of labor is very common. Obstructed labor can happen, so this can be avoided by just diagnosing, doing a sonography, doing a pervaginal examination, whether the patient should be allowed to deliver normally or it should be an elective cesarean section. Now, after delivery, what can happen? She can land up in PPH because the uterus, the muscles, the retraction of the muscles may not be as good. She can lead to, she can have PPH. Then there may be subinvolution. Now, we know the subinvolution, the involution is happening because of muscular contraction and retraction. The uterine muscle has a property of contraction as well as retraction. It retracts. Now, that retraction might not happen because of the fibroid. So, that leads to subinvolution. Okay. These are the effects of fibroid on pregnancy. There is another one, that is uterine inversion. We read this, that this can probably happen because of the fundal fibroid. The fundal fibroid can make it so heavy that it can lead to uterine inversion after delivery, because at that time the uterus is quite soft and it is quite vulnerable, so it can pull it down. Okay. And the last thing that can happen after pregnancy, I told you infection as such in fibroids is not common, but it can happen after pregnancy. So it can lead to puerperal sepsis. Puerperal sepsis, that is probably because of instrumentation and because the sinuses were open, so the fibroid got infected. So these are all the effects of fibroids on pregnancy.